Hi, my name is Elizabeth Paranzo, and I'm going to present today on the behavioral interventions utilized for individuals and children with ADHD. We're going to briefly discuss what ADHD is. So, according to the Diagnostic and Statistical Manual of Mental Disorders, the fifth edition, DSM-5, attention deficit hyperactivity disorder, is characterized by a persistent pattern of inattention and or hyperactivity and impulsivity that interferes with functioning or development. So, as we know, as ABA therapists, RBTs, and future behavior analysts, often our students are dual diagnosed. So they might have autism and ADHD. However, there are individuals out there that only have ADHD. They do not have the autism diagnosis. However, there has been a significant amount of evidence shown that applied behavior analysis does support the treatment for individuals and children with ADHD. So that goes to discuss the evidence-based decision making when supporting individuals and children with ADHD. So, why do we use ABA? We use ABA because it breaks down large tasks into smaller and more simple, manageable tasks. And that supports a lot of our kids with autism, but it also does support our kids with ADHD. So, how do we know what intervention to use when supporting individuals with ADHD? Well, just like anyone with autism, we would go to the data. So we would make sure we get our consents. If we're in a school district, we would shoot over to the IEP. We would get our family's consent. Then we would get an IEP meeting in order, depending on who the referral is being made by. We would want to make sure we're remembering our functions of behavior when we're going to discuss what interventions we're going to utilize with these individuals. As we know at this point, we have the four functions. So we have medical, escape, attention, and tangible. So we want to think about those functions when we're choosing which intervention to utilize. Of course, we're going to always use database intervention. So some interventions to briefly discuss would be NCR, right? So we can implement non-contingent reinforcement and maybe the form of attention. So with the social praise that we're maybe going to provide an individual with ADHD, just like we would with autism, which has shown through research to increase on-task behavior. It's important to differentiate between the type of praise we might be providing as an example. So that could be specific versus general. In addition, we have DRAs, we have an FCT. So those are additional interventions that we can utilize with individuals with ADHD. So if we find that one of our kids are not the level of attention that they require is not being met, maybe we'll find that through the functional behavior assessment. We can manipulate the environment to provide that attention appropriately and more functionally. We can also teach functional communication training through, different forms of applied behavioral principles. We can utilize visual schedules. We can utilize electronic daily behavior report cards, which is another schedule reinforcement that we can implement through technology. So we can do a visual, we can do paper, but this specific research does represent the electronic daily behavior report card, which is much newer, which has shown to increase classroom behavior with students with ADHD. So that holds them accountable, which is also part of our self-management strategies that have shown to be successful with kids with ADHD in the classroom setting. Now, behavioral parent training, we know what behavioral parent training is because we utilize that, right? So we utilize that often when we are providing parent training to our kids' parents at this point in our academics. we have probably, I know I have experienced actually implementing parent training with supervisor support, the BCBA. So in the same way that would work for a student with ADHD, and this is evidence-based, it's interactive, it's educational. We utilize modeling, VST strategies, visual schedules we can actually implement in the home setting to help with routines. Um, and we can model how to um, implement the schedules of reinforcement. So we can model that DRA or DRI or NCR for the parent in the home setting, or we can do it in an academic setting where we can teach. Okay. And this is shown to really support the families as a whole, as well as the child. And that goes hand in hand with social skills training and reinforcing pro social behaviors. So, through function based interventions, we can really make it individualized, right? But social skills training is also proven to be supportive for these kids. Now, through interventions such as goal setting, self monitoring, ABA principles, teaching choices, autonomy, they hold the same truth for this diagnosis. So we can go ahead and utilize ABA principles with students with ADHD. And it shows to be effective. And some ethical considerations we want to really take into consider is the BACB code of ethics, right? So we are saying behavior analysis and we abide by that code. So when implementing applied behavior analysis with students with ADHD, we need to really understand like our scope of competence. So if we are working in a clinic setting and we are providing services to students with, say, autism, and we are speaking with a parent and they start asking us questions about ADHD, like that, we're not doctors, right? We're also, we're not there to provide that information, even though we have some information right now through our education and our experiences. So we're going to just do our job as RBTs or behavior analysts and seek out additional support. So if a caregiver is asking for information on ADHD, we might refer them to a clinician or a neurologist or their pediatrician, or state just redirect back to what our goal is as the provider and what our role is specifically. And those are some ethical considerations we need to remember as professionals. And we also need to always go back to that data decision making. And of course, we need to make sure we're getting our consents in any treatment that we provide. Future research considerations, I personally would like to see the effects of medication treatment versus behavioral intervention treatment for ADHD, because stimulant medication versus ABA, I would really love to see what the outcome is and what it would be like to do a study on individuals that are only receiving ABA and individuals that are receiving both of ABA and stimulant medication. I also think that the access to ABA treatment through health insurance would be interesting to learn more about, because as of right now in certain states, really from my knowledge and from what I've researched, we're really only seeing autism being eligible to bill for ABA. I do know that through school districts, you can provide behavioral intervention, but it is different than ABA. And billables are also quite political. So I would definitely love to see more future research in collaborating between insurance providers, school districts, and just seeing overall how much more we can utilize ABA in the field of ADHD treatment. Thank you so much for listening.